Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello everyone. I welcome you to our today's session brought to you by the Oxygen Alliance. My name is Victor Mzende, a biomedical engineer for the Oxygen Alliance, and I will be hosting this webinar today. If you want to be added on our emailing list, you can also type your email in the chat as well to get notifications from the Oxygen Alliance. So I'm excited to introduce to you a new theme today for the second quarter of this year. So as you are aware, the Oxygen Alliance is taking a themed approach to its webinars. So for the second quarter of this year, we are going to dwell on the theme titled Management of Medical Equipment. So in this theme, we are actually going to tackle a wide range of medical equipment, ranging from dialysis machines, we'll also be tackling the dental units, we'll also be tackling endoscopy technologies, as well as oxygen equipment. So it will be a broad theme tackling the procurement process of these equipment, the technical repairs and troubleshooting, among other areas. So for today, we'll have an introduction to this theme. So for the intro to this theme, we have two of our engineers who will be taking today's webinar. So one of the engineers is Engineer Brenda Ruhanga, who is a biomedical engineer at the Global Health Informatics Institute under the Open O3 initiative. And the other engineer is Engineer Kondwani Chiponde, who works at Reverend John Chirembe Hospital, located in Kalombe, here in Malawi. So along the way, there will be a link of an attendance form that will be dropped so that we just get your feedback on our webinars and identify areas for improvement. Take note that your feedback matters to us because it helps us to accommodate our webinars to your needs. So without wasting much of your time, I'll hand you over to our first presenter today, who is Engineer Kondwani Chiponde. Over to you.
All right, thank you so much. Indeed, my name is Kondwani Chiponde. I'm currently a senior biomedical engineer working with Ministry of Health, Palombe District Hospital, under Palombe DHO District Council. Yeah, welcome you all. My task this morning is just to take you through, as Victor has already said, we're having an introduction. So we will not be going deep into these aspects, but we just have an introduction so that the webinars coming ahead, they can build from there. So my humble this morning is just to take you through the first 35 minutes on the management of medical equipment, and my friend is going to continue from there. So let's get started.
Engineer Kondwani, someone just asked you to raise your voice a little bit. I think they can get you properly.
All right. Can you hear me from there?
Yes.
All right. Yes. All right, thank you. So if I'm audible enough, then we can proceed, Tim. So today, as I've already said, we are just introducing on the medical equipment management. We know medical equipment management is a broader and important concept of which each one of us as engineer or technician needs to know. So by the end of this, we should know what is medical equipment management, its importance, especially in healthcare delivery systems, what are medical equipment life cycles, and what are some of the core components of equipment management. For core components of equipment management, my colleague is going to take through there. So let's get started with what is medical equipment management. Next, what is medical equipment management? So medical equipment management can be defined as a systematic way of studying and optimizing all the phases in the life cycle of a medical equipment. So we know a medical equipment has different life cycles, of which we're going to go through, and the next webinars are going to emphasize on them. So why is it important that we should study and optimize all the phases of life cycle within the medical equipment stay at our facilities? One is to ensure equipment is available all the time and is in good condition and is safe for use, both patients and even the user himself. And the second one is it reduces cost of operation and maintenance and maintains hospital reputation. So when you manage an equipment very well, you reduce the cost of maintaining it unnecessarily. Next. All right. Now, what are different equipment life cycles that that are there? I know this may be summarized.
Sorry to interrupt you, Engineer Kondwani. If possible, where you can just turn on your camera so that our audience can also see you.
All right. Thank you so much for the observation. I'll be turning on my camera so that you can see me. So let's proceed. Medical equipment life cycle. So we're saying every medical equipment undergoes a life cycle, just from the point of procurement to the point of disposal. They all undergo a certain or particular processes. So those are called life cycles. Now we start with planning and procurement, commissioning and acceptance, operation and use, maintenance and support, and decommissioning plus disposal. These are some of the important life cycles which an equipment has to pass through. All right, so the diagram there just depicts the diagram just depicts the summarized life cycle. So we are going to go through each one of them as we go along through the presentation. Let's start with planning and procurement. What is planning and procurement? So the most important aspect of planning and procurement is the need assessment. So before you plan and even procure any medical equipment, there has to be a need for that equipment. There has to be a need to procure that equipment. Now, what are the triggers? In other words, what can cause a hospital to procure an equipment? So these factors can be divided into two, internal or external. Looking at internal, we may have an updated equipment of the same time which is outdated. We may have maybe a budget to be allocated for purchasing of an equipment, or even the hospital wants to offer the new and even better services, so they may proceed to buy the new or replace the equipment. So all those things will trigger a hospital or a facility, a health facility or a health system to procure new equipment. On external factors, we may have donation. So we may receive an equipment, it's a part of procurement, even an increased population demand, regulatory requirements. Bodies may require you to purchase maybe equipment of the newer technology. Now, after you have done, after these have triggered, then you need to carry out a need assessment. So a need assessment will verify whether that equipment is really needed or not. So factors that should be considered whenever you are carrying out a need assessment include clinical, economic, patient-related, and organization factors. I'm sure these are going to be explained as we go along with the next webinars. Now, there is a model which is called HTA unit model. This model just tells us that whenever you are doing a need assessment for an equipment, the assessment has to be done at all levels and by all professionals, whether doctors, engineers, human resource team, they need to be included in the system. And after you have carried out an assessment, you need to prioritize the findings. So you need to prioritize whether you really need a particular equipment or the other technology. So what I'm trying to say is whenever you're carrying an assessment, you can have a bunch of technology that you want to procure. And you want to, there is a bunch of technology out there that can be procured, and you want to select which one is the best. So after you have come up with lots of technologies that you may select, That's when we need to prioritize your needs. So there are various tools which are used in prioritizing, including 2x2 prioritization matrix, and even other decision matrices that you can use. Whenever you are prioritizing the need, you just need to consider the short terms, just purchasing of the equipment. You need even to consider long terms and even operation planning, such as capital investment plan, in which you are looking at all the areas that can support the equipment to be purchased. All right, let's move next. Now, after you have done assessment and you have prioritized your need, you have come up with equipment that you need. Now you need to develop specifications. So specifications refer to the requirements that you need the supplier to give you, or manufacturer to give you, pertaining to your equipment. For example, you can specify in terms of electrical voltages. You can specify in terms of electrical power, water supply, environmental factors, for example, pressure and temperature, the maximum pressure and temperature or minimum, manufacturing policies, size, installation protocols, capacity, or even you can even specify the level of technology, in which you include whether you want your machine to be automated, semi-automated, or even manual. So you can specify that one. Now, another important part we need to consider is whenever we are carrying out our specifications, unless it is a single source procurement process, then you need not to you need to generalize. In other words, you don't need to you don't need to specify the brand. For example, you want to purchase a concentrator or a CT scanner. You can't say I want Devobis concentrator or Siemens CT scanner. Then I think that is not allowed. We need to be general enough. All right, so let's move to the next point. Now, after you have developed your procurement processes, you have developed your specifications, then when you submit your specifications to the procurement bodies. So there are different procurement models in which they will be discussed ahead. We can have centralized or decentralized, voluntary or mandatory, specialized or generalized, or public, hybrid, in which we have both public and private, or even the private as a single body. Now, in a public model, this is owned by a public body, for example, a government or something like that. And then we have a private. So in private, you need to pay them so that they can process the procurement processes for an equipment to reach you. Now, there are different steps in which an item can be procured under a public procurement process, procurement model. So in some steps, you need to prepare the document. Then you need to notify the potential suppliers. Then you need to, after you have received the suppliers. So after you have notified the potential suppliers and they have showed an interest in supplying, screen them whether those suppliers they are capable of supplying what you want them, and then you invite them to bid for supply of an equipment. And after that, you carry out what we call respond to clarifications, so that the supplier exactly knows what you want. After that, you can also receive and evaluate bids, and then you can award the contract, and after awarding the contract, then everything starts. So this is just one of the procurement processes, but there are many various ways. So it's just emphasizing on one of the generalized procurement process. So let's move to next. So after the supplier has received the contract and he has delivered the items, and then the process of commissioning and acceptance. So in commissioning and acceptance, we start with receiving and unpackaging of the goods. So this can be done by either a supplier or even the hospital staff, we as engineers on the hospital or on the health service facility. From there, you can check all the documentation and verify equipment if it's not broken, or if what you specified in your bidding document is what has been supplied by the what has been supplied by the procurement body. And then from there, you carry out assembly and installation. So in assembly and installation, this is where now you connect your machine physically for larger machine, you connect it physically to maybe the room or to the hospital, and then you connect it to power, or even there is an IT connections or something like needing fixing of the machine or stuff like that. That's when you now bring the machine into your hospital. After you've done that, then you start commissioning. So most of us we tend to confuse what is the difference between installation and commissioning. So in commissioning is now where you are now initiating the device to. Yeah, so it involves processes like you start a visual test after you have done installation or you have done everything. Then when you need to do a visual test on your machine. After you have done a visual test, you need to do even safety and regulation test. And then you need to do performance and calibration test. So just to make sure that now equipment is ready. After that, after it has passed all these processes, then when you can accept and hand over. So it's important to accept. In some cases, we have acceptance certificates where you can give to the machine or maybe to the supplier, in which you record an equipment in inventory, you label it with a tag number, train the staff, and even hand over the equipment to the users. So after you have entered into inventory, you have trained the staff, and then that's when you are comfortable to give like that is ready for use. I hope you can know we are together there. So let's move to the next slide. Now, after you have handed over the equipment to the user, that's when there is a phase of operation and the use. So the key elements involved during the operation and the use of equipment include following standard operating procedures. So it is important for us engineers because the user cannot go into the user manual and take every detail of the equipment. It's important for us to summarize how to use the equipment in what we call standard operating procedure. And then you can summarize them in one paper and give the user during. So this minimizes errors that the user make. It's also important for users to clean and disinfect equipment regularly, inspect equipment regularly for us as engineers, because that's where we identify errors that may arise due to maybe changes in environment and stuff like that. We need also to provide continuous trainings. Why? Because the users may shift. The ones we have trained today may not be there tomorrow. So it's important to continuously provide trainings to the users and follow all recommended maintenance protocols, of which my friend is going to come in on what are recommended maintenance protocols, even including the calibration. All right, so let's move to next. Now, during the use, we also as engineers need to provide maintenance and even support, as I've alluded above. So we need to provide maintenance and support throughout the cycle of an equipment as part of equipment maintenance. So we need to collect training needs. The first part of providing support is the training and continuous skills development. We need to continuously develop skills of the users as they are in contact with the machine. So during the training and continuous development needs, we need to collect the training needs. Most of us will just go and start training without collecting training needs. It's important too. We need to develop training plans and even training materials. So whenever you develop a training plan, you ensure consistency, and even training material ensures quality improvement. Quality assurance. If your friend comes tomorrow to teach on the same machine, he will not move up and down, but just go straight from the materials. You need to plan and carry out the training regularly and allow even feedback from the users on the training you have carried out, because if you don't do so, then you want to know how you can improve it. Now, after you have done, just as you provide continuous skills development, we need also to do maintenance programs. So maintenance programs need to be developed as we need to have a maintenance plans. For example, we can have planned preventive maintenance plans and schedules, and even the checklist. So the checklist is what most of engineers we miss. We can draft out training maintenance plan, but we don't, equipment maintenance plan, but we don't come up with checklist. We don't come up with checklist. So checklist is the ensure quality assurance. Now, we have 3 types of maintenance: corrective, in which we repair the machine after it has broken down; preventive maintenance, which is aiming at identifying and correcting the needs before the machine breaks down; and even predictive maintenance. In predictive maintenance, this type of maintenance is not common, but it's very important, because here you have an equipment. You can put specific factors like sensors or stuff like that will alert you to know that equipment needs maintenance. For example, you can be based on maybe running hours, or some people will put the temperature sensors and say if the temperature reaches this far, then the machine needs maintenance. All right, so upon providing maintenance services, let's move to next. Harold, Lloyd, can we move to next? So we need to do calibration. So calibration is the process now whereby we are trying to bring back the machine performance which has deviated from normal. So there are different types of machine calibration in which you can have a pressure, temperature, flow, electrical, and even other types of calibrations which you can do. So when should we do calibration of an equipment? After installation. Every time you have done an installation, we need to do at least a calibration. For example, next, it is important to do calibration. When the results are not trusted, for example, the user continuously tells you that the results are deviating from normal. When the equipment issues a warning, so in some equipment, they will issue that this machine needs calibration based on how it has been programmed, and even at the intervals specified by the manufacturer. So a manufacturer may specify that I need maintenance. This machine should be maintenance in maybe in 1,000 hours. So it's when we need to carry out. And another support under maintenance is inventory. So my friend is going to come up with a lot of details on inventory, but the most important part is we need at least to update it twice. It's important to update it regularly, but you need to update it even twice a year for the whole facility. But you can update your inventory as regular as possible, especially when you have a new equipment or an equipment which has been declared obsolete. All right, thank you. Let's move to next. All right, so finally, we are going to discuss on the issue of decommissioning and disposal. So that's the end life of our equipment. So after the equipment has come to an end, that's when it needs to be disposed. So an equipment should be disposed based on acts and regulations of within your country. We know we have different PPDAs acts and regulations in various countries. So a decommissioning needs to be done based on the protocols. So decommissioning involves removing devices from the point of use and even in inventory. Whereas the sensitive devices, all the sensitive data that were stored in the machine, for example, maybe in patient monitors or in X-rays or other devices, you may keep sensitive information. So it may involve maybe synchronizing the information to the cloud database before you elase for future reference. And then you decontaminate and dispose the devices. So a device can be disposed in many ways. You can navigate maybe spare parts. You can remove spare parts and use for similar devices. You can donate. So you can donate equipment if you still have a value inside there. We know you can calculate the value of equipment. I'm sure in here we are going to emphasize on that and how we can calculate the value of an equipment. So if the value still remains in an equipment, you can still donate to other health facilities. You can sell or even send it back to a manufacturer for refurbishment. And during all these processes, you need to follow all the standards and both international and even local standards in terms of management of medical cycle. So WHO has a series of standards that it has developed, under medical equipment devices. So you can go on WHO website, just find out what WHO has written, and then you can be conversant. Even on international standards of operation, or even international electrical commission standards, they are all important for us engineers to go through and learn and know how they are, because they assist us so much so that we can follow safety rules and all we need to observe during the processes. Now, during running time of our equipment, we need even to follow risk management and the patient safety. So whenever equipment is is in use, it can pose safety issues both to users, to us as engineers, and even to the patient. So it is utmost responsibility of engineers to make sure that they are observing all the necessary protocols in terms of risk management. Now, what are some of the terms? I know we will go deep maybe in near future in terms of how we can manage risk when equipment has been used, but we can just have some terms just to highlight what is an incident. So an incident it's an occasion that has occurred that may lead to a damage of property or even a death of life. I mean, death of a person. And the risk now it's a probability that that incident or a hazard is going to happen. And normally a hazard it's now something that can pose a damage, that can bring out a damage. For example, we can have maybe electricity. It can cause maybe electrocution or stuff like that. So that becomes a hazard. Now, just to summarize, a risk management process needs to undergo the following orders. So you need, whenever you are carrying out risk management, you need to establish the context. So the context involves the policies. What are policies saying about risk management? We can have local policies like here at 11 John Chimbe. I remember we involved in developing local policies in terms of risk management. So it tells you about the context in which you are going to handle your risk issues. And then you need to identify the risk. After you have identified the risk, you need to assess the risk. So there are risk matrices that are used there, and normally you follow them to rate each risk. After that, after you have rated the risks, then you need to respond. There's ways in which you can respond to a risk. Just to highlight, you can avoid the risk by using another alternative technology. You can even, if the technology is not avoidable, you can find an alternative. For example, like even training the users, that would reduce the risk of misbehaving with an equipment. You can even leave the risk if it poses less danger to the surrounding. So all that is involved in responding to the risk. So we want to minimize as much as possible to the level whereby the risk will no longer be harmful to our users. So during this process, you should monitor and communicate. So you should continuously monitor with the users and even the surrounding, the guardians and stuff like that. And finally, you need to evaluate and learn from the lessons. So risk management it's a live document. It's a live process whereby you just don't do it for a day. You continuously do it and update it and learn from there. Thank you so much. I think this is all what I have. Otherwise, let me give the floor to my colleague who will continue with core components of medical equipment and the systems. Thank you so much.
All right. Thank you, Engineer Bombani, for that wonderful presentation. Right now, before I hand the floor to our second presenter, I just want to remind the audience about the BM Quasar app, which is an Android application that has been developed by the biomedical engineers at Oxygen Alliance. So this app serves as a resource hub, providing access to maintenance videos, maintenance manuals, and different other resources. So you can actually download the app on Google Play Store. Additionally, a link has been posted in the chat, so you can actually just put on. I can just click the link and then it will direct you to the app. Before I hand it to another presenter, if there are questions, we'll take 2 questions, and then we can proceed to the second part of the presentation. So if you have a question, you can raise your hand or just type it in the chat. Then our engineers will take your question. All right, I can see Zava Chris has raised their hand, so you can just unmute yourself and ask your question. As you are typing your question in the chat, we'll be taking that question at the end of the presentation. Right now, let me hand the floor to our second presenter, who is Brenda Lohanga. Over to you.
Thank you very much, Victor. And I'm Brenda Lohanga, an engineer with the OpenNode crew, and I'll be taking you through the core components of the medical equipment management system. So these are the 2 main components of the management system. We have equipment inventory and categorization, but also preventive and collective maintenance. So firstly, inventory is simply a record of all medical devices in your healthcare facility. This is important, or it is essential in tracking medical devices. So as my colleague already mentioned, you do not have to be moving up and down to track a certain equipment. You can simply look at your records and know if the equipment you're looking for is still in use, or it is being stored somewhere, or it has been decommissioned. This is also essential for easy planning. Like you can plan for the maintenance, you can plan for spare parts, and you can also plan to get a replacement or an upgrade. It also supports safety and compliance, but also accreditation. So, for instance, if you want your organization or your healthcare facility to be accredited in the management of medical equipment, if the accreditors are able to see that you're able to manage your inventory properly, it would be a good indication of proper responsibility in maintaining or caring for your medical equipment. This also facilitates quick access to data of medical equipment, as already mentioned. Equipment inventory is important as it avoids duplication of, let's say, you have certain medical equipment that you have already recorded. With the previous records, it will easily prevent someone else from recording the same device all over again in the system. It also ensures that you have proper schedules for collective maintenance, but also preventive maintenance, as you know the conditions that your medical equipment are in. It is also good for accountability on the part of maintenance engineers, as they will be able to provide them with information on the location and the state of the equipment. So what can you include in your inventory? You can always include the equipment name or the type of the equipment. You have the model and the manufacturer of the equipment. You can also have serial numbers. You can have the location of the equipment, as for instance, the department or the room numbers or the ward, or if it is in storage or it has been decommissioned. You can also have the dates of your purchase or when it was installed. You can have the current status of the equipment. You can also have your maintenance history, the warranty information, but also asset ID or barcode. So these asset IDs can be the ones that you have generated in your organization for health inspection, as there will be special identifiers for the equipment for your organization. Having these internal asset IDs is important, as it will give you a better clarification of or interpretation of your records. For instance, if you're using serial numbers, or if you're using the models or serial numbers. So you have internal control for tracking. You also know where the equipment is located, or if you have similar items. For instance, if you can have similar IDs for equipment that has similar use. For instance, emergency equipment, and so on. On the part of categorization, You can, when doing your inventory, you can group these medical equipment in several categories. This is good for ensuring that for ensuring preventive maintenance, for efficient allocation of your resources, and also assessment of in cases of emergencies. So you can group these equipment according to their use. You can group them according to the departments that they have been placed in. You can group them according to the list that they pose, but also their criticality. So in terms of criticality, you can have high, high criticality medical equipment like life supporting, the medium criticality like diagnostics or therapeutics, the low criticality equipment as those that do not come with those that are not non-patient contact, or that those that are supporting equipment like thermometers, BP machines, and so on. With this, you can have those devices that are likely to cause an accident, or those that have high consequences of failure on one side, and those that are not likely to cause risks on the other side. You can also group them by department. For instance, you can have certain identifiers for medical equipment that are found in the ICU or radiology or laboratory or in the general wards or at patient clinics. And lastly, you can group these medical equipment using according to their use or application. For instance, you can include those diagnostic medical equipment on one inventory tab, those that are used for treatment on another, for monitoring patients, and also for those that are for controlling the environment, like light. So, how often should the inventory be updated? So, it is a recommendation by the WHO that the medical inventory should be updated at least twice a year, but you can also update this as much as you need to. Like, let's say you have acquired new equipment, you can always update the inventory, or you can choose to do it monthly. You can choose to do it when you have decommissioned some equipment, or when you have done certain maintenances that require recording. You can also update your inventory. Secondly, on the preventive and corrective maintenance, so developing a preventive maintenance schedule. So let's say in this case, we assume that you already have your equipment inventory. It will then be easier to come up with the maintenance schedule as you have already done the first part of coming up with the maintenance schedule. Then from there, you can determine the intervals of your maintenance. So based on the equipment criticality, after assessing the needs and criticality of equipment, you can come up with maintenance schedules for every equipment that you have. Then from there, you should assign the vendors or technicians that are going to work on your maintenance, on the maintenance of equipment. You can choose to have your paramedical engineers work on the maintenance of equipment, or you can use other contractors from outside to come and do the maintenance if you do not have the tools or you do not have the capacity to do your own maintenance. Then from there, you can add, let's say you have your maintenance schedules in spreadsheets or Google Sheets, you can add reminders on your Google Calendars to alert you every time there's need for a preventive maintenance to be done on certain medical equipment. It is also important to group similar tasks so that when you have resources, you can be able to, when you have the resources, you can be able to work on certain issues at the same time. This will save time, but also it will keep the technician on the same routes of maintenance. Then from there, you should review and update regularly. So you adjust the frequencies based on area trends. Then you include new equipment. Let's say you have added new equipment and they are of critical need for maintenance. You add them on the schedule. For collective maintenance, creating a schedule for collective maintenance usually starts when you have received a service request, like from users or you have received issues of breakdowns on certain medical equipment. So this usually starts when you have a service visit. Then if you have a lot of issues or maintenance to do, you will start with prioritization. So you start with the medical equipment that most departments depend on or are used in emergencies. Then from there you go to the high critical medical equipment. Then lastly you do the routine. You do the collective maintenance for the routine. That is, you will now consider the list of the equipment that are broken down. Then you can also assign these maintenance to technicians based on the skill sets, but also the location and capability of your health facility to handle the maintenance. Then secondly, you deal with the work order management. So on the work order management, as I already said, if you're on the work order management, if you do not have the capacity to maintain, to do the maintenance as a facility, you can always order labor from outside, the spare parts, but also vendor calls. You can also track the downtime. That is, if it is taking longer than expected to do the maintenance. And finally, the root cause analysis. So if there is medical equipment that keep on failing or fail repeatedly, you need to do the root cause analysis to come up with failure codes and also devise proper collective maintenance options. That would work efficiently on such kind of medical equipment. And that is all that I had for you today. And I'll hand over the floor to the host.
All right. Thank you, Brenda, for that wonderful part of the presentation. And overall, thank you, our two engineers, Engineer Kongwani and Engineer Brenda, for this session that you have delivered to us. Now, our audience, the floor is up for questions and comments. But before that, I just want to remind you that an attendance form has been dropped in the chat. We just want to get your feedback so that it helps us to tailor our webinars to your needs. So just fill out the attendance form, where I will be taking 2 or 3 questions from you. So if you have a question or a comment, you can just post it. You can just paste it in the chat, or you can raise your hand and I'll give you an opportunity to ask your question. All right. Meanwhile, there was supposed to be a question from Nzava Chris, and you did not take the question in the first part of the presentation. So this is an opportunity for you to ask your question. You can raise your hand and unmute, or you can just paste it in the chat. So I can see Faraj has asked that, can we get a soft copy of this PowerPoint? So actually, I have to tell each and everyone on this call that all our copies with presentations will be posted on the DMW Kwanza app. So if you have access to the DMW Kwanza app, it means you easily get access to the soft copy of this PowerPoint as well. Additionally, we also post the recorded sessions of this webinar on our YouTube page, on our YouTube channel. So you can also get access to this material through the YouTube. There's also a question in the chat from Joseph Bates. He's asking great methods, but how can you incorporate the small basic portable diagnostic equipment such as pulse oximeters, wrist blood pressure monitors, and thermometers? So our engineers, you can take that question.
All right, let me come in. That's a very good question. In most of the cases, especially in Malawi habits, I don't know, maybe other countries it may be like that, but we have a tendency whereby these small portable devices are omitted. They are not taken as devices as such. And I've seen a couple of times doing some supervisions somewhere where some other engineers could tell me I cannot do preventive maintenance, or I cannot do management of this because it's just too small. I can't take care of it. But then it equally plays an important role, just as any other huge device, huge equipment like ultrasound or maybe X-ray machine. So I personally I personally, in practice, put into account such small devices, because if you can observe, they take almost maybe should be 30 to 45% of total equipment available on the health service, on the health facility. So if you omit them, it means you're even omitting the greater part of the equipment within of the health services, and you may see the services being compromised. So as what we do in Palombe District Hospital, for example, in terms of management, we make sure that every equipment which is coming into the system, normal equipment comes through the Department of Pharmacy. So what we are doing is we have inventory at hand for a particular department or a particular section, and then any equipment which is coming from the pharmacy has to pass through engineering department. Why? Because we need to put it in inventory. We need to provide the trainings. We need to test the machine. We need to calibrate the machine, and then we need to initiate what we call a health passport. Now, this system it may be new to others, but it's a system like we want to introduce a health passport to an equipment so that you can trace it from the time it enters into the service and then time it exists, like disposal. So yes, it's important to incorporate these small devices throughout their life cycle. And sometimes it comes to the issue of safety, because these are portable devices. People can simply put them in their bags and pockets, and off they go home, and they use them at home. Maybe they have private clinics. So if we omit these devices, we'll still incur high cost, because we are not able to trace small devices that really matter in the provision of health services to the facility. So if I may answer partially, maybe that would be my response. But if there's more to be clarified, then you can say it out. Thank you so much.
Sorry, Joseph, that you are calling on, and you have answered very well. I wanted to emphasize with our teams that yes, the medical devices and equipment, they are all under maintenance control from biomedical engineers, and so we should never neglect them. So we really need to think
Joseph, we lost you for a bit. We can't hear you.
On having all these devices in our inventory, in our program, the wrong temperature in the triage, then that will be a problem, even if you have the big diagnostics like radiology and ultrasound. Thank you.
All right, thank you, Joseph. So we'll just take 2 more questions and then we'll close our today's session. So there's also a question from Japhet. He's asking, what is the difference between repair and corrective maintenance? So our engineers, you can also take that question.
Okay, let me take that one. So repairing and corrective maintenance are not different. They're almost the same thing. But if you mean the preventive and corrective maintenance, then preventive maintenance is more of routine maintenance. Like you don't wait for the device to break down before you do the maintenance. So you do routine checkups, changing the like, for example, filters and so on. While collective maintenance and repairing, you have to wait for the device to break down, and then you have to do the repairs, or you have to maintain the equipment. And on the other question by Johannes, the difference between model list and medical device development plan. So a model list is simply a list of all medical devices that you have in your facility, while the medical device development plan is a document that illustrates how your facility is going to acquire the medical equipment, how they are going to maintain it, or if there will be any need of replacement, how they will also replace it or decommission it. So if you need further clarification on these 2 questions, I think you can always come back.
All right. Thank you, our engineers. I hope all the questions have been addressed. So I can give an opportunity to 1 more question. one more question rather. Engineer
So-
Kondwani, you have something to say?
Yeah, I just wanted to add on what Engineer Brenda said. Yeah, so really corrective and repair, they are similar. In some cases, the corrective is called demand maintenance. Repair may be called demand maintenance, and the corrective may be called breakdown maintenance. Of course, in some books, they will differentiate to say repair is more of now what we do when equipment is breakdown, but corrective is more like bringing back the deviation of an equipment. It's like more like bringing back the deviated performance of an equipment. But they really mean the same thing. Only that some books will choose to differentiate to say repair is more of now bringing back an equipment which is completely down. Yeah, you can't hear. Oh. So in some books they would specify repair as bringing back an equipment which was completely down. But then corrective, it's more like aligning equipment to its original performance. An equipment which was down, but it wasn't really completely down. I would get an example for equipment which is functioning partially. So you just want to bring it down to full functionality. But then it means the same thing because fundamentally you are trying to restore the functionality of a machine. So I just wanted to concur with my friend Brenda. Thank you.
All right. Thank you, Engineer Kondwani, for those insights, and Engineer Brenda for your responses as well. So, reaching this extent, our audience, that marks the end of our today's session. We sincerely thank you for joining us today. If you have questions or comments, we would love to get them, so you can just email us at info@oxygenalliance.org. And if you have any technical question, just email us at helpdesk@oxygenalliance.org, and our team will get back to you immediately. Otherwise, it has been a pleasure to have you on this call. Have a wonderful day.